Hello.
We would like to tell you a story.
My colleague here was approached to assist a young man, age about 19, who had an intellectual disability.
Surprisingly, he was living alone in his own apartment, and we were told he merely needed help getting up at 6 in the morning to get to school. He was in a large apartment building with others who were elderly or were disabled and living off of Social Security.
This was quite impressive. He must be very high-functioning, especially since he had been in some kind of human service housing since he was a child.
Yes, you would think that, wouldn't you? However, as you can guess, the reality was something else.
When you first went to meet with him, his apartment was a disaster. Indeed, it was a health hazard. There was food and feces about the walls and floor. You worked together with him to clean it up, washing everything and disinfecting walls and surfaces. You did laundry.
Yes. He was a very nice young man, and for many weeks I came at 6 in the morning. Woke him, made sure he showered, and waited with him until the school bus came. I would cook for him.
But it was soon clear that he was a danger to both himself and others.
If we cleaned in the morning, in the evening his apartment would be trashed, frequently with food and feces apparently tossed about. Sometimes food dumped on the floor. In addition, he smoked, and there were large burn holes in the carpets. There was a danger of setting the entire building on fire.
He was also subject to victimization from others in the neighborhood who would pretend to friendship in order to use his apartment for various reasons.
I challenged such individuals on occasion.
One was hiding in the closet when you arrived one evening. You kicked them out of the apartment.
Yes. I'm indeed surprised I was not beaten up.
You make me laugh.
I wrote detailed documentation on each visit. Though I had developed a good and trusting relationship with him, it was not enough. He needed 24-hour assistance for health and safety.
How is it that this nice young man with an intellectual disability was living on his own?
It is one of the ironies of the human services.
Both his parents suffered from a severe mental illness and were unable to care for him. As a result, he was in supportive housing as a young child.
He first tried to kill himself around age 8 or 10.
When he turned 18, he now had the legal right to make his own decisions.
However, he did not have the ability to be responsible for the consequences of his decisions.
It is one of the ironies of the human services that we talk so much about rights, but not so often about responsibilities.
Or perhaps it is one of the stupidities.
Perhaps.
Of course, after being in human service housing most of his childhood, he wanted to go back with his mother, who had severe mental illness.
And though this was a very bad decision, it was his right to make the decision, and so it was allowed.
Within days, both of them were in the psychiatric hospital. So they found him a subsidized apartment by himself.
Did you mean to say they dumped him in the apartment by himself?
I did not say that.
You make me laugh.
After many months.
Did you tell them how frequently you got diarrhea when working with this client and how you did not have insurance?
You make me laugh. As I was saying, after many months, so clear he was unable to keep himself safe and healthy, and was even a potential danger to his neighbors, they finally moved him. Still in his own apartment, alone, but at least there were staff there during the day.
But not at night.
Correct, there was no staff there at night.
So was this going to be a successful outcome?
Of course not. He barely had adequate winter clothes. There was a big meeting with one of those wealthy-looking people who was some kind of county director, promising to bring a vacuum cleaner.
Of course, that never showed up.
Of course not. You can always tell the type: expensive clothes and artificial smile.
They get lots of positive attention at their cocktail parties for being in the human services. They like to think of themselves as wonderful advocates.
Eventually, of course, he trashed that place so badly they kicked him out. I do not know what became of him. I'm sure he would have been successful with the proper level of care.
If we didn't laugh so much, we would collapse in tears and despair.
Yes. This is true. It is one of the ironies of the human services.